Clearly, for providers, payers, and others in the healthcare space, meeting meaningful use criteria is critical. A couple of major elements in terms of meeting meaningful use requirements include privacy of data and interoperability between systems. At Verizon, we are providing a cloud-based health information exchange which leverages our HIPAA-compliant data centers and our secure communications platform. Furthermore, with the universal identity solution that I talked about earlier, we can truly authenticate both patients, providers, and other entities who have access to this data. Thirdly, as we look at interoperability, our cloud-based health information exchange truly provides a mechanism for different systems, electronic medical record systems, and others to be able to interoperate with each other and be able to update patient information as required in the marketplace. Verizon is very excited in terms of some of the current technologies that we are focusing on from a telehealth and a home health perspective. We have worked with the major vendors of equipment providers in the marketplace, such as Cisco, Polycom, and others, to truly develop a complete suite of telemedicine, remote diagnostics, those types of services for providers in the marketplace. Another area that we are very, very excited about and have a robust offering is in the space of home health. As we look at the marketplace and look at the continuing aging of the population, it is no longer relevant to simply provide care in a physician's office. You need to think about long-term care facilities. You need to think in terms of nursing homes, independent living organizations. All of that is important. And the ability to provide services wherein that patient can access a clinician, whether it be a nurse, a physician, or anybody else, from where they are living, is far more critical. Furthermore, we are also exploring the areas of social media so that we can create a mechanism for patients to be able to access their clinical providers effectively in a secure fashion and ask questions when they have the question, as opposed to waiting for the next scheduled appointment. So this whole area of telemedicine, home health, telehealth is something that we are very, very focused on. Clearly, we see this whole evolution in health IT as being patient-centric. You really have to think about the patient in the middle of all of these services. At Verizon, as we look at this space and as we think about the network that we have, the ability to leverage video, whether it be in a nursing home, a long-term facility, or anywhere else, to help the patient keep their regimen, to educate them on their disease, to educate them on self-medication and all of the other things that you need to do is significant, especially with the evolution of the wireless network. As the fourth generation of wireless gets deployed, now you have a much higher level quality of video. You're thinking in terms of 1080p technology. Therefore, you now have the ability to truly have that level of patient education. More importantly, if you also think about some of the other areas from a continuing medical education perspective, from a CME perspective, you could have a specialist in one hospital be doing a didactic conference to residents and other physicians in a completely different city or in a different hospital system or wherever they might be. Furthermore, as we have all heard about this, and there certainly are examples in the marketplace in terms of robotic surgery and other types of services, the evolution of the wireless network and the wireline network will make this far more practical and far more feasible on an everyday basis.